Well, it's not even close, right? Steroid or cortisone injections, is poison for your body. It's going to affect every single cell in your body, no matter where it is injected. Even when you get a steroid shot into your knee, it's still getting absorbed into your body. So mood swings, sugar spikes, weight gain, depression, everything kicks in with the use of steroids. And I've seen patients with joints getting destroyed because of use of steroids. There's an interesting study out now that says that patients who got cortisone injection, steroid injection into their joint had actually had much poorer outcomes after joint replacement surgery. So that tells you what a footprint steroids can leave. So absolutely, there is no comparison. It doesn't even come close to discussing stem cell treatment in the same breath as steroids. This is totally opposite. This is totally designed to preserve your joint, avoid replacement surgery, joint replacement surgery in the future, and keep you pain-free and active, which is very, very important. The quality of life is very, very important. You don't want to have a functioning mind and a beating heart if you cannot move, right? Physical mobility is what brings flavor to our life. Our ability to travel, our ability to play sports is so essential to our well-being, and especially, in our golden years when we worked all our life and finally you have some time, the kids are grown up, and now you're thinking you have your time, you're retiring from your job, and that's the time your joint starts to give away, which is the ultimate tragedy. And then the treatment of getting cortisone injections or getting surgery, which can set you back easily 6 to 8 months of just rehab, and that is if the surgery really goes well, right? So I think stem cells are changing the dynamics there for a lot of patients. But again, the caveat always is you have to get the right treatment before you can expect those results.